And I work at Miracle Feet, an organization that helps doctors in developing countries cure clubfoot. I will present the Miracle Feet brace and how it will make clubfoot treatment easier on a global scale. Clubfoot affects 1 in 750 children born worldwide. That's 200,000 children every year. 80% of those children do not have access to proper clubfoot treatment. Clubfoot means that their feet go inward and upward, which makes it almost impossible to walk. So the gold standard for clubfoot treatment is the Ponset method, which consists of 6 weeks of serial casting, followed by wearing a brace full-time for 3 months, and then at night for 4 years to prevent the feet from going back into the clubfoot position. Miracle Feet started working with Dr. Laura Ferreira in Brazil in 2010, and the major hurdle she was encountering was that half of the children she was treating were coming back to the clinic with relapsed club feet. So children were using this brace, which is made of hard leather and which is very hard to put on. And brace noncompliance is the only significant cause of clubfoot relapse. And research shows that a more comfortable brace for clubfoot could reduce the relapse rate. So Miracle Feet started working with the Stanford School of Design's course Design for Extreme Affordability to create a low-cost but comfortable and easy-to-use brace for clubfoot. So Stanford students spent time in Dr. Laura Ferreira's clinic in Brazil talking to parents of children with clubfoot and to clinicians to really understand what they wanted from a clubfoot brace. They went back to Stanford, prototyped the brace, got feedback from Brazil, and designed this brace for clubfoot. So the shoes clip on and off the brace. The shoes are made of soft canvas, which prevents the blistering, which was happening with the previous brace. The bar is made of strong acetal, and it sustains about 60 pounds. The brace is injection molded, so it can be scaled according to demand, and it costs only $12 a piece. The shoes cost only $6 a pair. There are 3 sizes of bar, and the bars can be recycled, and there are 7 sizes of shoe. This is the size 3, and that further reduces the price of clubfoot treatment. Children can walk and stand and crawl in this bar, and children can be held by their parents very easily in it. So we have tested this brace at our partnering clinics in Brazil, but also in Nicaragua, India, and South Africa. And parents prefer the Miracle Feet brace to the Steam Beak brace, which makes us believe that this brace could reduce clubfoot relapse. So we are in early implementation phase, meaning we will roll out the brace starting in May 2015 to 4,000 of the 8,000 children we're helping to treat. So we will concentrate on 3 clinics that we're helping. Each clinic has 50 children. So half of these children will be using the Miracle Feet brace, and half of these children will be using the Steam Beak brace. So we use a database called the International Clubfoot Registry, where we have the data for all the patients that we help treat. This includes the Pirani score, which is the measure of correction of clubfoot. So we will measure the Pirani score for a year in those 3 test sites, but also for all the other children. And we will compare the Pirani score of the children wearing the Steam Beak brace to the children wearing the Miracle Feet brace, and we expect it to be better. That means lower for children wearing the Miracle Feet brace, but we will also survey their parents throughout that year every 3 months to understand whether they prefer the Miracle Feet brace to the Steam Beak brace. We have raised over $300,000 worth of design for the brace, and we have commitment from donors to produce and to help produce the brace in the next year, but we still need to fundraise for the testing of the outcome of the brace. So our team consists of 6 main people: Jessica Mansfeld, who is the CEO and co-founder here at Miracle Feet. She is a business leader, has gone to the Stanford Business School, and has created several startups. Beatrice Plaza is a public health expert, has worked at Measure here in Chapel Hill, but also in Colombia for over 10 years. And Ian Connolly and Jeffrey Yang designed the brace and are still consulting. I spent last year in South Africa testing the brace and am now coordinating. And Dr. Laura Ferreira is still a consultant on the brace. Thank you.